Hello, my name is Noel Bell. I'm a psychotherapist based in London, and today this podcast will be chatting about sex addiction and a new framework for treatment. And it's really a new framework that I'm really interested in hearing about. Bill Herring, based in Atlanta. Bill, good morning to you. It's afternoon here, but how's your day unfolding there at the moment?
Doing fine so far. I appreciate being here. Thanks for inviting me.
Great. Now, Bill, just a quick bio. You are a counselor, psychotherapist for over 25 years, right?
That's correct.
And you're sex addiction certified with CSAT.
Yes, I am.
In Atlanta, Georgia.
Yes.
So I guess we'll try and keep it to a reasonable amount of time. I'm just sort of aware with these sort of topics, we can sort of potentially have so many strands going on that we could get lost with, usually on my part, of course, tangential sort of areas. One thing I do want to start with, just before we get into the specific area of sex addiction and treatment addiction in general, could you just give us a background on what your influences were in terms of modality, theoretical orientation, and what were your big influences, what made you become a therapist, that sort of stuff?
Oh, sure. Well, there was a philosopher, I forget his name, but I remember the comment that he said that life is lived moving forward, but understood looking backward. And so in terms of my the course of how I became a psychotherapist, what I would have said at the time is different from how I would say now, looking back at it. Certainly have always been interested in helping people. And when I started to focus my psychotherapy practice, I started with a very general practice. I basically saw everyone. And as the years progressed, I narrowed and limited my focus more and more. And the issue of addiction was always one that I had as a focus in my clinical practice. And then 20 years ago or so, when I first started learning about sex addiction, that became more and more an area of interest of mine. And there were few therapists at the time that were really doing this work. So because of that, I started drawing in more clients, and that's sort of how a niche develops. That I sort of went both in the area of my interest as well as in the area of need. And so it's been in that capacity over the years that I have really focused on looking at how people engage in forms of problematic sexual behavior that can really cause a lot of disruption in their lives and obviously in the lives of people around them. And being a person who has followed this field for some time and who has offered my contributions in terms of articles and workshop presentations and so forth, I came to feel that there was a gap in the way that we look at certain forms of sexual behavior. And I came to realize that we may be trying to put too many types of behavior into one label, and that's the label of sex addiction. So even though you introduced me as talking about sex addiction, actually, the way I come about it is wanting to look at how sex addiction itself fits within a larger understanding of what do we mean when we say that a person's patterns of sexual behavior are problematic. And so that's what drove me to do research and reflection and consultation, and really over a period of time came up with what I call a framework for categorizing chronically problematic sexual behavior. And in that way, sex addiction is part of that. So.
Okay, now, so we'll get on to talk about the categories of your new framework and how they differ in your mind from the existing treatment models that are there. So just before that, though, yes, there's the whole kind of question of what drew you to, because I mean, I read Out of the Shadows, Pat Carnes' book. I guess he's kind of like the granddaddy of the sex addiction field. And I remember being bowled over by the time years ago. And then, but Bill, I have to say more recently, yes, I've kind of questioned the whole disease concept, brain change model, and, you know, the 12 steps approach, which can sometimes be very deterministic. And then I've sort of looked at choice model and, you know, Gene Hayman's work, and then whether problematic, any kind of behavior, whether it's even substance abuse or what we're talking about here, no ingestion of substance, but a behavioral thing, gambling, sex addiction, whether it could be self-medicating and it's not, you know, i.e. an illness or disease model. So I guess with all that, the question then is, what drew you to Pat Kahn's model?
Well, as you said, there was a time in which he was, and still is in many ways, I mean, he's very revered. He really helped put the concept of sex addiction on the map back in the 80s. I read the same book that you did and thought that he was brilliant. And as I came to know him and train under him and look at more of his writings, he's been very prolific and has really helped to make a very profound stamp upon the way that we approach these kinds of sexual behaviors that we call sex addiction. Now, the issue that comes up around that is that, in my mind, clearly, sex addiction is a theory. It is a way of looking at or framing behavior so that we can make some sense out of it. And we can say, what do we call this? And therefore, we can say, what do we do about it? And again, very valuable. But I have gotten very convinced that many behavioral patterns that look very similar may come from very different drivers. Maybe addiction is a driver for some people, but maybe it's not for others. I agree that the disease concept is very valuable, the disease model. It is, however, a model. And I would be hard pressed to put sex addiction in the same category of a disease as I would put cancer, leukemia. Those are, in many ways, a cancer has affected humans or life forms for thousands of years. What we call sex addiction, I believe, in some fashion, is culturally determined. I think that it's hard to separate out addictive use of sexual behavior from some larger influences in our culture, which is why, and I love the fact that you brought this up, my framework specifically speaks to problematic sexual behavior and not necessarily pathologic sexual behavior. Pathology is an illness or a disease that's located within a person. Problematic can be more looked at as a lack of fit between the person and that person's behavior and the larger environment. So problematic does not have to mean that there is an illness or a sickness within a person. It may be, but it certainly speaks to the idea that there's conflicts between a person's sexual and non-sexual parts of their life, and that becomes the problem, which led into 5 different categories, which I'll get into in a moment.
Sure. So I guess that sort of, because some people like the idea of a condition, a brain disease, a bit like similar sort of area with SSRIs treating depression. They like to think there's a chemical imbalance. If you take the magic pill, because you've got a condition, everything's going to be fine. And that sort of works for some people on long-term medication. Now, if people are applying the sort of disease model to sex addiction, you're essentially taking on that there's brain change as a result of the behavior, and therefore you've got impaired vision. I mean, that's what Pat Kahn says when I listen to him speak. Now, we're at a time, Bill, when the United States and Europe is the headlines are all about celebrity abuse, or we better be careful, the lawyers will be knocking on the door, but there's allegations in the movie industry around individuals being sexual predators. Now, often when I'm out and about, people often say to me, easy for him to just suddenly go into rehab and blame it all down on an illness. And what about personal responsibility? Where do you come in on that?
Great question. I think that to the idea when people see someone who has notoriety and they're crashing and burning, and then the next thing you know, they've gone into a rehab or some sort of treatment clinic, it's easy to look at that and say, well, these facilities are where the rich and famous people go to get out of responsibility, without actually realizing that many people go to these facilities just many more go that we don't know about than the ones that we do know about. And I have seen many lives absolutely transformed by people who go in that direction and really take responsibility, develop greater empathy, get better impulse control, look at what might be in their life earlier on that may have contributed to this behavior. But in all cases, if somebody is going into treatment or somebody is calling themselves a sex addict, it is correctly used, it is never a way to remove a person from responsibility. It actually goes the other way, that a person accepts responsibility for all of what they've done and has to own that there's work that they have to do on themselves in order to be transformed. Now, again, I don't think it's necessary to have a label of sex addiction to be transformed. What it is necessary is to acknowledge that I have a problem. This is the nature of the problem. I want to do something different, and I need help to be able to do that. And that's where this, my 5 categories of problematic sexual behavior can come in to help people identify where exactly are they having problems, and then they can look at what to do about it.
People must be bursting with enthusiasm to hear these categories. We will get to them in just a sec. But just before that, the debate around our psychiatric colleagues with DSM, the American Psychiatric Association's diagnostic tool, was it 2013? It came out with its 5th iteration, and it didn't include a sex addiction or sexual disorder, apart from the other disorders, the paraphilia, but not the actual sex addiction term. So, do you agree with that?
I understand where the controversy is. It's in some ways it was disappointing. In other ways, it's understandable once you know how diagnoses are made. We'd like to think that they're all based upon scientific evidence, and they are. And yet there is also, let's just use the word politics involved. There's tremendous influences that go back and forth into whether a collection of behaviors should be looked at as diagnosable or not. Because once something is diagnosable, then insurance opens up to be available for that, and it's very much reified. I think that the main difficulty that the DSM folks had, or one of the main difficulties, again, has to do with language, nomenclature. What do we call something? And that sex addiction, again, is a theoretical way of looking at a set of behaviors. And there's different frameworks for looking at that as well. Some people may look at the similar behavior as being compulsive, but not addictive. And there's slight little nuances of distinction between those two, but those nuances carry a lot of weight when it comes to deciding what do you call this thing. So I think in part there's been a struggle in figuring out how to reconcile all of the different theories that look at this behavior to come up with one that's overarching to say, this is really what we're talking about. And I think the DSM committee got caught up into that. And so until we can get past looking at specific theoretical labels for sets of behavior, that's always going to be a problem.
Because it's quite interesting, isn't it, that WHO and the ICD-10 is included gaming disorder, where DSM-5 only said it was there for further research.
Yes.
So, yeah, I mean, it's just, isn't the whole sex addiction, we get into the whole morality thing as well.
That is part of it, and I know I keep coming back to it, but one of the dilemmas I've been trying to resolve is how to take the morality piece out.
Right.
Now, there are some things that are right and some things that are wrong in general, but so often our understanding about what makes behavior either appropriate or inappropriate says as much about the person who's looking at that as it says about the person who's doing that. And it's really hard. I think it's very difficult, even for very trained psychotherapists and people who are very wise, to not have their personal sense of morality sometimes influence what they see in the person that they're trying to help. So I have worked to take the strictly moral piece out of the discussion, as well as even taking the behavioral piece out of the discussion. And as you'll find in a moment, the way I look at this behavior has nothing to do with what a person is doing or how often a person is doing that. is doing it. And I think that that is crucial, because anytime that we are assessing behavior as being either normal, adaptive, or problematic, anytime we're using behavior to determine that, we run the risk of putting people into that category who are engaging in that behavior but don't have a problem with it. So we have to look past what is a person doing and how often is that person doing it if we really want to have a value neutral or a morality neutral way of looking at what do we mean when we say that sexual behavior is problematic.
Sure. Now we've done a good drum roll. We've got the 5 categories. We'll go into them now. So Bill, you're a lead trainer for SASH, so the
Yes.
Society for the Advancement of Sexual Health.
Yes, correct.
I'm loosely involved. I'm not a member. I'm loosely involved. I'm on the blog submission subcommittee or something. We meet by email. Yeah, some great people working there. So so you have devised a new framework,
Yes.
distinct treatment model.
Yes.
Well,
I'm going to back up with that, because this becomes an important distinction. The word framework is different from model or theory. That I would say that a framework for anything is the most essential elemental components, of that issue. I consider them being like bricks and mortar, or a solid foundation for a building. That once you start with that foundation and you've got those essential bricks and mortars, you can build all sorts of buildings on top of that foundation. And in my case, I use the word buildings to stand in for theories. And you can build all sorts of theories once you've got a solid basic elemental foundation. And part of the struggle in our field is that there has not been a foundational assumption of what makes sexual behavior problematic, other than primarily the sex addiction model. And that's understandable, because at that time, there were very few ways of looking at this behavior, and looking at alcohol and drug addiction behavior was very easy as a drag and drop. Apply it over there, it's going to apply here. And I think that's why the sex addiction model has so many characteristics that are shared with traditional alcohol and drug treatment models, which are 12-step programs and so forth. But if that's the most elemental, fundamental aspect of that theory, that actually doesn't go, in my mind, more fundamental enough. So I wanted to break that down, to take loss of control or impaired control is one of the bricks, but there's several others as well, and we need to put them all on the same level. And so maybe I could go into it from here.
Sure. What would the 5 categories be, and then the questions that would inform each category?
Sure, thank you. Well, as I lay them out, they're going to be very straightforward. When you start to think about it, I tried to make this not complicated, to be one that's just common sense. And then if you look at it, you can say, I can see how this can be useful. So here's the 5 categories that I would consider to be equal determinants of what we could call chronically problematic sexual behavior. And I use the word chronically because that means I always want to specify we're talking about an ongoing pattern, not just one event. Because anybody can have a problematic moment, but that doesn't necessarily define the pattern that we're dealing with. So in terms of the patterns of behavior, here's the 5 categories that I would look at. One is commitment violations. Any sexual behavior, any ongoing pattern of sexual behavior that consistently violates a person's commitments.
Consistently is an interesting word.
Yes.
Yeah,
but we all may do something that crosses the line, but it wouldn't necessarily be indicative of something that's ongoing for us. Let's go back to alcohol for a minute. A person may overdrink, but that doesn't make them an alcoholic if they go out once a year and they drink too much. Or even if a person has a negative consequences, like maybe they get arrested for driving while they're intoxicated. It's certainly a problem. In and of itself, it does not say that there is a historic problem. Once you look at a number of categories or incidences, then you can start to infer that there is a problem. But yes, I think once is not enough with this. So a consistent pattern of commitment violations is very clearly an example of what we would have to describe as being problematic. Now, a commitment violation may be somebody they're missing work, they're missing appointments, maybe they're not going, they stand up a friend for a meeting or a get together because they're doing whatever they're doing sexually in such a way that it's sort of swamping that. But the primary commitment violation, far and away, that has the most damage is people who violate the commitment of sexual fidelity with a primary partner.
Yep.
Somebody who's engaging in secretive, deceptive behavior that's not known about. Just because it's not known doesn't make it any less problematic. In some ways, it makes it more problematic.
Yeah.
So that's the first category, is someone who is consistently violating their commitments. The second category, it would be sexual behavior that violates a person's personal value system.
Mm-hmm.
If I'm engaging in behavior and then I come out of that and I say, I don't like it that I did that. That's not me. This is not behavior that I like to think about myself. I think of myself as this kind of person, not as that kind of a person. When I have values turmoil because of my sexual behavior, just inherently, I have to look at that as being problematic. Now, again, maybe not pathologic. It may not say that there's a sickness in me, but it certainly shows that there's a problem in the way I'm living my life. Now, here's something that I think is very important to understand about this framework, is that it will look at sexual behaviors, but not necessarily, it's not necessary that a sexual behavior always needs a sexual solution. Mm-hmm. Let's take the first two categories of commitment violations and values conflicts. These problems can be reduced either by changing the sexual behavior or, as an example, changing the commitment. Mm. Person in a relationship who's violating that fidelity commitment is engaging in problematic sexual behavior. If they are no longer in that relationship, there's no commitment to violate, all of a sudden that category of behavior is no longer problematic, even though the person may be doing the exact same thing.
Yeah.
I'm saying that the other categories may not be problematic, but that one category goes away.
What if it, sorry, Bill, if with a violation committing, because I remember discussing this with Mary Deach, the issue of people who might have shall we say, a standardized commitment, fidelity, but then it might change to be an open relationship. Now, I know you can still have lies and cheating within open relationships because you go beyond the agreement. So if someone was committed and they were honoring all their promises to be one-on-one, but then after some violations, they agreed with their partner that it would be, hey, we're going to be an open relationship.
Sure.
Where would that fit in to the whole area of, would that still be problematical?
Well, for that category, and again, we're going to look at each of the five categories, we can look at them independently of the others. So that's a brilliant example of negotiating through a commitment violation in a way that changes or modifies the commitment rather than changing and modifying the behavior. So in that sense, if everybody's in agreement with it, from that category, there's no longer a problem. So a sexual problem doesn't always need a sexual solution. And the same with values conflicts. If my sexual behavior and my values are in conflict with each other, I can change my sexual behavior in some way, or I can change my value in some way. A prime example of that may be someone, let's take a person who is engaging consistently in maybe secretive same-sex behavior. And they don't like that about themselves because of whatever feeling. They don't want to think about themselves as gay or so forth. So I've seen many people who would say, I have a problem. My behavior is going against my values. What's wrong with my behavior? And sometimes it can be heartbreaking to me that I would see that person as perhaps at their core, they may be gay, they may be bi, but with that not being a value that they can live with, their behavior then becomes the problem. But I have also seen people who have grown and evolved and who have said, for instance, one time I thought that I was a sex addict, and now I know that I'm gay, and my acting out behavior was my true nature. So in that sense, it's another example of a values evolution, you could say, our values change, that decreases the problematic nature of the behavior. So the behavior that can continue and the value can change. And to me, this is a really core part of this framework, is getting out of the idea that always says that sexual behavioral problems require sexual behavior solutions.
Because the thing is, that's a really good example, because I mean, the whole issue of contextual investigation as a therapist, you might uncover some crazy religious stuff from childhood, puritanical, sex is bad, and there might be some family message. You know, we don't do sex here. We might make babies, but we don't talk about feelings, and sex is not for pleasure.
Right.
So actually, someone is reacting in their adulthood to a lot of those scripts.
Yes.
Rather than necessarily being an addict.
Yes. Yes. Well said.
Yeah, because that's the, you know, that's this where I think the integrative approach, the eclectic approach to looking at this area is important, because you're looking at sort of, you know, early life material. So the third one then is around self-control.
Yes. The third of the 5 categories of problematic sexual behavior is reduced self-control. I don't want to say absence of self-control, but let's say reduced or diminished. Now, this is the classic category where sex addiction would come in as one of many different theories. Compulsive sexual behavior, hypersexuality, out of control sexual behavior. There's different ways of terming that. But what all those are referring is that category of diminished self-control. So that's the one, again, that has the most theory base around it. It has the most methodologies around it. And so far, within most models, is the required, I would call it the gatekeeper diagnosis, the gatekeeper symptom that allows a person to access care. And again, what about all these other folks? So that's that one. Shall I go into the last 2, because I know we're short on time?
Yeah, the only one question I had on that one, Bill, was so the choice model, rather than the disease model, would say maybe there are lots of people that are potentially out of control with behaviors, sex, gambling, or with substance, cocaine, alcohol, whatever. But something happens in their life. Their boss says, pull your socks up, bucko, or you're out of here.
Yes.
Or a partner might say it. And they do pull their socks up.
Yes.
So again, the loss of control, they can wrestle control back. Now the 12-step model would say, no, you've got an illness, it's progressive and it's fatal, and it's gonna, so you've lost control.
Yes. Which is true for many people. Many people do have that loss or that diminished control, and many people don't. And that's, it is one reason that in my clinical practice, in my caseload, I have many individuals who have engaged in very similar behavior. If you just looked at what they did and how often they did it, they would look very similar to each other. Some of them claim or demonstrate that they have loss of control or diminished control, and others, they don't show so much as diminished control. And so what's left? And for me, what's left is they do it because that's what they like to do. They do it because they've gotten away with it. They've done it. Perhaps it's a personality issue. Perhaps they've never particularly thought it through. Perhaps they never had role models. Perhaps they thought that somebody doesn't know won't hurt them. Perhaps they've never had an opportunity to just unpack this and get a more nuanced understanding of what drives their sexual choices and the impact it has upon others. And again, as long as we shove all that into the theory of sex addiction, a lot of those conversations don't get to happen, because now we've moved from what have I been doing to what do I have to what am I?
Yep.
And once it turns into a noun that labels me, then there's a whole lot of conversations we can't have. But once we look at what is problematic, what doesn't fit between me and the world around me, then we can look at all sorts of ways of addressing this problem that doesn't require diminished control.
Sure.
So I have a lot of men's groups. I have psychotherapy groups with men, all of whom have had behavior that's crossed one or more of these different categories. Some of them identify as sex addicts, some don't. Some of the sex addicts go to 12-step meetings, some don't. But coming together, they all benefit from the same way of looking at the behavior. So I find this is very helpful at reducing resistance. Who wants to take a label? Sometimes it works, but if I can give you an opportunity to address your behavior without having to label you, I have all of a sudden made it easier for you not to be resistant at taking on a label that may not fit for you.
So, because I also noticed on your website, you run groups. Is it groups or individual sessions for mature clients dealing with porn?
Mm-hmm.
Yeah. So what about the whole MESA thing, the machine-enhanced sexual arousal disorder? Do you see much of that with porn?
Very, very much so.
Yeah.
And we could have a whole conversation, obviously. We could spend quite a bit of time talking about online pornography delivery systems, which, as you know, is unheralded. And we're still coming to understand how much that can swamp the brain circuitry. And I do believe that it actually can make changes to the way that our brains operate. And the good news is that once we get away from the porn long enough, so often that can revert back to baseline. But this would be a nice entree into the fourth category.
Yep.
You can look at porn as well. So the fourth category is simply looking at negative consequences, a pattern of negative consequences. Excuse me. And the idea here is that conceivably a person might engage in a pattern of behavior that does not violate any commitments. Maybe they haven't made any commitments. It doesn't violate their values because they may be okay with it. It doesn't even represent diminished control because they're choosing to do it. But they still may have negative consequences. I will say that a person who's arrested for being with a prostitute, especially if that happened multiple times, that's a problem no matter how the person got there. So if we look at negative consequences as a standalone category, again, it's common sense to say, problem is as problem does. If problematic outcomes continue to happen, then you have to look at that behavior as problematic. Porn is a subtle example. As you know, there's many people who report starting with one sexual interest when they're looking at pornography, and then based upon flooding and the need for novelty to bring in more dopamine.
There's an escalation. Yeah.
An escalation. And the next thing you know, people are getting physiologically aroused about material that can horrify them. So that can be an example both of a values conflict as well as a negative consequence, maybe erectile dysfunction, that they can no longer perform sexually with another person like they can with masturbation. That would be looked at as a negative consequence.
Sure. And just on that one, I mean, I personally believe that we're living through a game changer. Particularly, it's not just the internet; it's the fact that it's mobile telephony with mobile broadband. That now you can take that device anywhere you want to go. Where before it was pretty much stuck in one position in the house. Right. So, is that do you see it a game changer in the sense that before there may have been people, erotic magazines, sexual fantasies, acting out, brothels. God, how old has that been? But where has the real toxicity for you come about from online porn? Mm-hmm. And the dating and all the extra peripheral stuff as well.
Well, now you're speaking just direct center to, as you say, the game-changing moment in our history that we are in. I would say we're having a series of collective game-changing moments. That one example being that the access to all the types of different sexual behaviors that people involve in, some people say that could even have, for some people, a positive, almost a sex education function. That people learn, oh, that's how you do that. Or I thought I was the only one to have this interest. Maybe more people do. So this speaks to the idea that I think that with the democratization of information, people are willing and able to look at many different sorts of sexual choices than they used to. And maybe finding new identifications for themselves. Many people say that that's evolution, that's progress, that's people being able to find their own sexual health vision for themselves based upon many, many more choices than we used to have. And of course, there's probably equal number of people who say this is an example of the degradation of our society, that everything is becoming relativistic. And so therefore, anything is good and not good, and whatever your sexual health vision is up to you to be able to do. And that's why our society is unraveling. So I think you have both sets of forces that come together, and you have this great, almost tectonic, two plates pushing together. Forces in our society, which is one reason why we're having such upheaval. Now, ultimately, I think this serves the positive goal, but it requires some positive improvements in the way, primarily in the way that we talk about sex and sexuality. Our language has not kept up at all with our behavior, and especially now, parents needing to talk with children about sexually explicit material has to be much more nuanced than we're having now. But we could have a whole conversation about having a porn literacy education and conversations. Invite me back and I'll be glad to talk about it.
Definitely. There's a couple of sub-themes. But just before we leave that topic, I mean, if Pat Carnes was here, he'd say there's a tsunami on the way in terms of the impact of pornography on kids and them watching it and how their brains are getting affected. And if we don't take account of that, we're unconscious about it. Then there's others who say, but hey, we've been here before. We've had the threat of rock and roll, and we've had video nasties. It's going to pollute kids' minds. And they say kids will work it all out.
Well, I don't think kids are going to work it all out by themselves. And again, I think that this does propel us into a need to be able to engage in sexual conversations with our children, that we can do more than just warn them away from pornography, because what good is that going to do? And even if you put,
they want to watch it more. Yeah,
exactly. Exactly. So what we need to be able to do is help kids to be able to talk more about what they see, how they feel about it, what is true and not true about what they're watching. What are the feelings of the actors that they're looking at? There's all sorts of very important conversations that we can be having with our young people. But of course, many people are still very hesitant to have those conversations. And I think oftentimes it's because of their own sexual shame.
Yeah, absolutely. Have we saved the best to last, the fifth?
I don't know if you want to call it the best, but the final category that to me was very clearly an example of problematic sexual behavior is sexual behavior patterns that violate, I would call them, basic human rights. And there's something, an idea known as sexual health. And sexual health can be looked at as a combination of what I would call mental health and public health, sort of balanced together. And for mental health, that's a very generic way of saying that there's a component of sexual health that involves how comfortable I am, how actualized I am, how my well-being is in relation to my sexuality. It really is about how I use it. The public health component of it is how my gains, what I'm looking for, interacts to other people. And if I am gaining some sort of sexual self-esteem, but it's coming at somebody else, from a sexual health perspective, from that public health perspective, I'm not engaging in behavior or I am engaging behavior that is inherently problematic. So I took the whole category of sexual health and tried to identify the core components of that apply to problematic sexual behavior. And I came up with 3. I like keeping lists kind of short. It's easier to remember. So for me, sexual behavior ceases to be responsible if there's not universal consent to what's happening. Everybody has to consent. And that's not just, let's say 2 people are being involved sexually. If one is in a relationship with someone else, that other person needs to be able to consent. So all stakeholders need to consent. The second is that everybody needs to be protected from unwanted physical consequences, from sexually transmitted infections and unwanted pregnancies and so forth. And I put that word unwanted physical consequences rather than just negative physical consequences to acknowledge that maybe for a small slice of people, there may be, and again, this gets a little off the beaten track, but maybe somebody who is they're in a masochistic relationship and they actually want to have some pain. Maybe they want to be whipped or something, and it causes maybe some welts or some bruises. Somebody could look at that and say, well, that's a negative physical consequences. Yes, but it wasn't unwanted.
Yeah.
Since it was wanted, and it's not, there's a difference between hurt and harm, hurt and damage. If there's not damage, then again, there's no problem there. So everybody must consent, everybody must be protected, and nobody must be exploited for another person's sexual gain.
Yep.
So if that's happening, any one of those, you would say your protective responsibility, your public health, your sexual health responsibility is not being met. Now, this is the category that comes closest to what we talked about earlier of morality. But rather than looking at it as a culturally, as a morality that may come out of a specific culture, and this is the problem, is that so many different cultures have slightly different ideas about what is moral behavior and what is not. So if we want to look at something that's universal and not just relevant to one culture or another, we have to get very elemental. And that's where, no matter what culture you're looking at, anywhere, it's universal that if there's no consent, if there's inadequate protection, and if there's exploitation, that behavior is inherently problematic. So that's, rather than moral, I would call that principled. So if you look at these 5 categories, they really are a combination of objective, you're either violating a commitment or not, subjective, a values conflict could be subjective, or principled, violating the sexual health of somebody else is a principle violation. So if you put those together, you have 5 different categories. And when you start to look at those, not so much as on-off switches, like it's binary, it's either there or it's not, but they're more on gradations, then you can start to have a multifaceted understanding of what makes somebody's sexual behavior patterns problematic in a very nuanced way that I think is going to point out more subsets and more incisive understandings of how a specific set of behavior can be problematic for one person and not the other.
So when is the book, Bill, coming out?
We'll see after today. And even what I love about this conversation is it actually even helps me to be able to say it in a very quick way. I want to be able to bring it out in a way that people can hear it and say, oh, that's understandable. And so my closeout part, and you referenced this earlier, is that I came to the realization that there's basically 5 questions that I can ask somebody that will tap into each one of those categories. And people can ask the questions in all sorts of ways, but these are the most essential elements of those questions. For violation commitments, I'm just going to ask somebody, are you keeping your promises? And we can have a conversation about that. What is a promise? What is an expressly defined promise? What is an implicit promise? We can have a lot of conversations around commitments just with that one question. The second question, which is after are you keeping your promises, is are you okay with what you're doing? And to the extent that I'm not okay with what I'm doing, I am referencing a values conflict within me. I'm not okay with that. So if we start to have a conversation, we can look at what parts of that, what value is it that's being brushed up against, where does that value come from? We can have all sorts of very rich conversations around that one question. The third is simply, are you in control of yourself? If we're talking about diminished control, or do you feel like you're in control of your behavior? And there's all sorts of conversations we can have around that. The fourth one around negative consequences, I'll simply ask, how's everything going?
Yeah.
And with how's everything going, that's an opportunity to look at all sorts of consequences in a person's life. And the fifth question is, are you protecting others? Are you wearing condoms? Are you getting consent and so forth? So with those 5 questions, within a relatively short time, I can come up with a very nuanced, multi-faceted understanding about what makes that pattern of sexual behavior problematic for that person. Then we can go into a conversation about whether it's pathologic or not, what sort of theory to apply to that, and then what sort of methodologies are we going to put to that to help a person get better. So to close out, in looking at sexual addiction, we can see how that is one component of what I can consider problematic sexual behavior, and that whether it's there or even not there, there's other ways of looking at sexual behavior patterns to determine what's problematic, what's working and not working for that person. And that way we can bring many more people into the conversation to talk about their sexual behavior in a way that's non-threatening and doesn't require that anybody even have to have an illness in order to be motivated to change their lives. So
yeah. Bill, I knew it could potentially have been midnight, so but we've identified a few areas there where we could have another conversation or conversations in the future. Bill, just finally, where would someone go to hear more of your work and how to get help? I mean, I'm sure if they're in Atlanta, they'll get in touch with you, but if they're in some far-flung parts of somewhere else, how do they access help?
That's always so difficult. Part of what the training is that you mentioned earlier that I'm have an instrumental role in with the Society for the Advancement of Sexual Health. We've put together an extensive training package, part of it being online, called the Advanced Training in Problematic Sexual Behavior. And this is going to allow many more people, many more therapists who may not want to specialize in this topic as the sole focus of their practice, but they need to get a more advanced, more comprehensive understanding. As they take this program, I think we are going to have many more therapists and many more professional helpers that are going to be able to offer service for this in areas that we don't have it yet. So I'm excited about that. In the interim, if people want to reach out to me, all you have to do is remember my name, which is Bill Herring, because my website is simply billherring.com. And my email is simply bill@billherring.com. So what I'm certainly willing to do with people, I don't want to be flooded with it, but if I can help someone find a resource, because I may not know the people, but I may know the people who know the people, and I can maybe help network so that someone can find the help that they need. But I've got a lot of writing on my website that can help. And there are people who do, telephone or distance counseling, and I can certainly help people try to find someone who can give them benefit from that perspective. And I can do that for a little bit. I typically don't do long-term psychotherapy online, but to help someone get situated, to get acclimated, to get oriented, and to go in the right direction, I'm fine with setting up some times that we can do that work. So I look forward to helping more people.
Excellent, and I'll put the links on, even though they were easy to remember, at the end of the interview in text format. So, Bill, thank you very much for the chat. I've really enjoyed it and learned a great deal, and look forward to chat again.
Very much. It was a pleasure. Thank you for having me.
Thank you, Bill.
All right. Bye-bye.